Wikidontist.com. Truth about tooth.
Good morning, and I am Dr. Thomas Nechupadam from Nechupadam Dental, and we are happy to inform you that you have been watching a lot on dentistry. If you are watching for the first time, please subscribe and also make sure that you press that bell button so that you will get personalized notifications whenever I upload a video. To know more about dentistry and smile and all the treatments, you have this English video, and also we have a Malayalam video which is called as Pls Doctor. If you are from Kerala, you can actually watch in Malayalam also. I've been a YouTuber for 11 years, and we've been doing dental videos in 4 different channels. So please look into Dr. Thomas Nechupadam, and you will see some of the reviews and things like that on YouTube. And if you are there watching me on Facebook or Instagram, I am also there, and please share onto your group so that they'll also understand what exactly it is. Kochi is a beautiful place, and people come for implants and things like that, and there's a lot of international tourists who come down here for implants or dental treatments per se, because of the treatment cost. Now, when I talk about implants, most of the people ask what is the cost. So now the cost of implant is actually divided into different segments. Sometimes when people are asked what is the cost of the implant, they just say for the first surgical part of it, or just putting the implant into the bone. So if you tell that, that doesn't help the patient to chew at all, because that is only the first part of it, the root part of it. The crown part is a totally different part. So only when you fix the crown and when it is functional, you can say that the treatment is over, because the patient's problem is not solved until then. So what are the costs which are to be expected for a implant? So when you give me a call, or when you write to me saying that I want to do this many number of implants, and can you tell me the cost? So it's a very big perplexing question, because if it is one implant, then it's a different cost. If it is multiple implants, if it's a full mouth rehabilitation, that's a different cost. More than that, there are allied costs to it. Now, when you come down, there is a consultation when you go to an implantologist, and there is a consultation which ranges from 100 rupees to 2000 rupees in India. So now that is the first one. So check out how much is the consultation. Second, sometimes it is done free. Okay. So now the second part is your diagnostic x-rays. Some people will ask for an OPG, some people will ask for full mouth CBCT. So that will range from, OPG will cost you from 500 to 1500. Full mouth CBCT might cost you from 1500 to 5000, depending on the materials, or depending on the machine, depending on the real estate cost in that area, all these things. So that is a cost. So that is the diagnostic X-ray cost. Now there are allied treatments which is required, which may be required, because if you have lost the tooth, other teeth also might have the same problem. So unless you correct that teeth, if you put an implant, only one implant may not help. So you need to check whether there is a periodontal issue. If there is a periodontal issue, that bacteria can cause implant failures. So we need to correct that periodontal issues before we start the implant treatment. Now, your next tooth might have actually migrated into the space. If you don't have enough space, or if your roots have actually moved into that place, even though the tooth looks wider, but the roots are very close to each other, then we cannot put an implant in that area, because we need to make a small space or a hole on the bone to put the implant. And if we cannot do it properly, or when we do the hole, if it touches the next to the next root, then it's a problem. So we need to move the roots, or sometimes the tooth away, and make that space for the implant, just like you correct the whole space for a house or things like that. Before we start the treatment, we need to check out all those things. So that's the second thing. Then if we need to understand, sometimes we might have to go for densitometry of bone. Sometimes we have to take graft from different spaces of your own body. Sometimes a graft from outside, an allograft or a autograft, or some graft may be required. All those things may be an extra cost to it. So ask your dentist before you start whether they need a graft, or if there is a graft, what is the cost which is involved. Otherwise they might charge you an extra fees for that. Now if the implant itself might range from 3,000 to 25,000 rupees. There are very cheap implants which doesn't have any credibility or FDA evaluation or any of these things which is available. From there to high quality implants are also available. So check out the quality of the implant, ask for the what is the company, what is the make, what is the material, all these things, what is the surface treatments. If you can understand that will be a great option before you start the implant procedure, rather than doing a low cheap implant into your body and get into trouble. Now that is the cost of the implant per se, the root portion which goes inside. Now after that the surgical part, the doctor might charge you for the surgical part, and for each and every part the disposables may be charged extra, the treatment, the surgical part itself may be charged extra. So just ask, when you ask for an implant, he might tell you exactly the implant cost only, the surgical may be extra, and all those things what I said before may be extra. So just ask what is the level of it. And when you put the implant, then sometimes we put the permanent teeth. In some cases it is loaded in 3 days, some cases it is loaded immediately, some cases it is loaded after 3 or 6 months time. Unless it is loaded with a crown, you cannot chew with it. So if there is no crown, then you might need a temporary bridge or temporary Maryland bridge, which is actually aesthetically pleasing, and some of the dentists will charge you extra for that. So check out how much does it cost for the temporization. So once the temporization is done, that is an extra cost. So if there is a cost, you need to understand that. Now after this thing, if you need to do a surgery to expose the implant, so that we need to put the abutment and the crown. The abutment is the joining part between the crown and the implant. So if there is a cost for the abutment, are they charging that extra? And the crown, different types of crowns are there, ranging from metal to ceramic or PEEK and things like that. So what is the type of crown, and whether it is a permanent crown or whether it has to be removed and changed into a better crown after some time, needs to be discussed at the time of the treatment rather than telling later, because that will also determine the cost of the implant procedure, because unless the implant has a crown and implant is restored to meet the next tooth so that he can chew, it is not finished. So please make sure that you ask all these questions before you start the treatment. Is there any other cost like anesthetic cost? Sometimes they charge for conscious sedation and things like that. Some people do it only under conscious sedation. So all these costs has to be clearly mentioned, or tell him that if you don't understand any of these things, you can just tell them what is the cost from start to end, and what is the type of this thing, what is the color given, and what is the material used. That at least that much you should ask from start to end. You should ask, take it as a package, so that you will get a better treatment and you will not spend more than what you expected. Expect what is exactly there. So that is why I have given this thing. I am not here to tell you this is the price of the implant, but these are the different variations of prices that might happen. So when you ask, even I am not able to tell you what exactly it's, because we don't know what exactly has happened in your mouth, how you lost the teeth, have you lost the bone and things like that. So we need to understand a lot more before we give you an exact plan and a treatment, this thing. So even if you ask someone, they will tell you a price, but it may be one part of it, rest of the things might follow. So at the end, to get a bite and to chew on that area, you might have to spend more. So please watch these videos, send it to your friends wherever they are doing some implants and things like that, so that they'll understand exactly what is going to happen before they get the tooth restored to function. So thank you very much for watching. If you liked it, please share it to all your friends, your people who have lost the teeth, or people who you think that it will be beneficial, so that they'll understand it much better. And also please make sure that you subscribe, so that you'll understand more about all the dental treatments which is available. If you have a query, please feel free to contact me as a comment, or you can actually look into other videos which is already there as link here. So thank you very much for watching. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi. Thank you.
Wikidontist.com. Truth about tooth.